Hi, I'm Joe Fifer, President and CEO of HFMA. Welcome back to our monthly web video series. This month, I'll talk about a common sense care approach to dealing with the primary care physician shortage. It's certainly looking that way. The typical primary care physician's patient panel is already about 2,500, and there are estimates that it could grow to 5,000 to meet increased demand. This growth in demand is a result of an aging population, expanded insurance coverage under the Affordable Care Act, and an environment in which young physicians expect a better work-life balance than previous generations did. Add it all together, and the Association of American Medical Colleges is estimating that we'll face a shortage of more than 45,000 primary care physicians by 2020. That's just 5 years away. So yes, I think we should be concerned. A few weeks ago, I had one of those aha moments in the middle of all places, my dentist's office. It was just a routine checkup. Most of the appointment was taken up by the hygienist who cleaned and evaluated my teeth. The dentist himself briefly stopped by afterwards, received a report from the hygienist, and then took a quick look at my teeth. I was confident that I received the best care, even though the dentist himself spent only a few minutes with me. And half that time was social. Reflecting on this visit afterwards, I asked myself, why doesn't the medical profession do what the dentists do? It's already happening, just not on a big enough scale. Some primary care physicians are creating care teams of mid-level providers, such as physician assistants and nurse practitioners, who leverage the physician's time and talents, and most importantly, build ongoing relationships with their patients. Actually, patients tend to accept these care models quite readily once they've established those relationships. This proven model would enable us to grow patient panels and to meet demand while reducing costs. As Atul Gawande said at ANI last year, there is simply no need for physicians to function alone anymore. In fact, they have a responsibility to create such care teams. For starters, learn about your state's licensing laws for mid-level providers. These laws define the scope of practice and supervision requirements. Make sure your organization is using mid-level providers to the extent allowed in your state. In general, you get the most value out of this care model when mid-level providers are practicing at the top of their license. Also, work with your clinical colleagues to ensure that staff are receiving the right training and education when practice patterns change. These steps are primarily on the clinical side, but they are key to mitigating organizational risk. On the finance side, as you're negotiating contracts with payers, promote payment policies that encourage appropriate use of mid-level providers. Also, support payment models that reward clinicians who choose primary care practice rather than the more lucrative specialties. First of all, keep in mind that the primary care physician shortage being forecast now is built on the assumption that physicians will keep practicing the way they have been. If we all challenge that assumption, together we could go a long way toward avoiding the shortage. There are other benefits that should make your time investment worthwhile right here and now in your organization. Benefits like higher overall quality of care, better use of expensive physician time, reduced physician burnout, improved patient satisfaction, and of course, opportunities for successful collaboration, which, as you've heard me say in the past, is the key to solving many of today's healthcare challenges. Thanks for watching. I'll see you next month.